If you are over 60 and waking up each morning with stiffness, discomfort, or even sharp back pain, you are not alone. According to the National Institute on Aging, nearly 2 out of 3 older adults experience daily back pain that limits their mobility and independence. But here's the surprising truth. In most cases, it's not simply aging. It's your daily habits. And some of those habits are silently making your pain worse every single day. In this video, I'll reveal the habits you need to stop immediately, the science that explains why they harm your back, and the simple solutions you can apply starting today. So stay with me until the end, because the habits we're about to cover could change the way you move, sleep, and feel every single day. Before we begin, please take a moment to like this video, share it with a friend or loved one who might also be struggling, and subscribe to this channel so you never miss future updates on senior health and wellness. Habit number 1. Sitting too long without breaks. For many seniors, spending hours sitting, watching TV, reading, or on the computer feels harmless. But prolonged sitting weakens your back muscles, reduces circulation, and increases pressure on the spinal discs. Research from Harvard Health shows that older adults who sit more than 6 hours a day are nearly twice as likely to report disabling back pain compared to those who move more often. The solution is simple. Stand up every 30 minutes and stretch, even if it's just for 1 or 2 minutes. Use a chair with proper lumbar support and keep both feet flat on the floor to reduce unnecessary strain on your spine. Habit number 2. Poor sleeping position. The way you rest while you sleep can either heal or harm your back. Many older adults sleep on their stomachs, which forces the spine into an unnatural curve. Others continue using sagging mattresses that no longer provide proper support. The Mayo Clinic found that switching to a medium-firm mattress reduces back pain symptoms by up to 55%. Here's what you can do. If you sleep on your back, place a pillow under your knees to keep your spine aligned. If you sleep on your side, place a pillow between your knees. And don't forget to replace your mattress every 8 to 10 years to maintain good support. Habit number 3. Ignoring core strength. At age 60 and beyond, muscle mass naturally declines, especially in the abdominal and back muscles. When your core becomes weak, your spine loses its main support system. This makes you far more vulnerable to injuries and chronic pain. A study published in the Journal of Geriatric Physical Therapy confirmed that seniors who practice simple core exercises 3 times a week reported less back pain and improved posture. You don't need a gym membership to strengthen your core. Try seated knee lifts, gentle yoga poses like cat-cow or child's pose, or even walking with slight abdominal engagement. These small actions done consistently can provide powerful protection for your back. Habit number 4. Lifting things the wrong way even if you no longer lift heavy boxes. Small actions like bending over to pick up laundry or groceries can still trigger back pain when done incorrectly. Many people bend at the waist instead of the knees, placing direct stress on the lower spine. The safer technique is to always bend your knees, keep your back straight, and hold objects close to your body. Avoid twisting your spine while lifting. These small changes prevent sudden strains that can lead to long-term problems. Habit number 5. Ignoring early warning signs. Many older adults dismiss back pain as just part of getting older. They tolerate it until it becomes unbearable. But chronic back pain is never normal. It's your body signaling an underlying issue such as weak muscles, arthritis, disc problems, or harmful habits. The American Geriatrics Society emphasizes that early intervention is critical. Treating back pain early improves mobility, reduces dependency on pain medications, and helps maintain independence. So don't ignore the signals your body gives you. Paying attention early can make the difference between temporary discomfort and years of chronic pain. If you found these insights helpful, please give this video a quick like. It really helps others discover this important information. And I'd love to hear from you in the comments. Which of these habits do you recognize in your daily life? To recap part 1, we've uncovered 5 daily habits that silently harm your back. Sitting too long, sleeping in poor positions, neglecting core strength, lifting the wrong way, and ignoring warning signs. Each of these may seem small, but together, they can create a cycle of pain and limitation. And here's the important part. We're just getting started. In part 2, we'll reveal even more surprising habits, including diet choices, stress patterns, and lifestyle mistakes that silently attack your spine every single day. Stay with me because the next section may surprise you even more. Now that we've explored the major causes and symptoms of chronic back pain in seniors, it's time to shift our focus to practical and science-backed solutions. Managing back pain requires a multifaceted approach, addressing physical, mental, environmental, and behavioral factors. The good news is that even small changes in daily habits can lead to significant improvements in pain and mobility. This part outlines proven methods, both conventional and lifestyle-based, to relieve existing pain and prevent further deterioration. 1. Daily stretching and mobility exercises. Why it helps. Regular stretching enhances flexibility, improves blood flow, and reduces stiffness. Gentle mobility exercises strengthen supporting muscles and restore range of motion. Examples: cat-cow stretch, spinal flexibility; pelvic tilts, core and lumbar support; knee-to-chest stretch, lower back tension relief; wall angels, posture correction. Scientific backing. A study in Spine, 2017, found that daily stretching significantly reduced pain intensity in adults over 60 with chronic low back pain. The American College of Sports Medicine recommends flexibility exercises 2 to 3 times per week for older adults. Tip: start with 5 to 10 minutes daily, especially in the morning or after long sitting periods. 2. Core strengthening. Why it helps. A strong core stabilizes the spine and reduces the load on spinal joints. It also prevents falls and improves balance. Safe exercises for seniors: seated marches, modified planks on knees or wall. Leg lifts while lying on the floor or bed. Bird dog with hands, knees on the floor. Scientific backing. According to the Journal of Orthopedic and Sports Physical Therapy, weak abdominal muscles are a major contributor to chronic low back pain in older adults. Tip: always consult a physical therapist before beginning a new core routine. 3. Posture correction and ergonomics. Why it helps. Good posture minimizes stress on the spine. Ergonomic modifications reduce repetitive strain injuries during sitting, lifting, and sleeping. Practical adjustments. Use chairs with lumbar support, keep feet flat and knees at hip level. Position screens at eye level. Avoid long periods of sitting. Stand every 30 to 45 minutes. Scientific backing. Applied Ergonomics Journal notes that ergonomic chairs reduce back pain intensity by 30 to 40% among older users. Tip: consider ergonomic assessments by occupational therapists for home adjustments. 4. Heat and cold therapy. Why it helps. Cold reduces inflammation and numbs sharp pain. Heat relaxes muscles and increases blood flow to promote healing. How to apply. Cold packs 15 to 20 minutes after activity or for acute pain. Heat pads or warm baths for stiffness or chronic tightness. Scientific backing. A 2018 meta-analysis in clinical rehabilitation confirmed that alternating hot-cold therapy was more effective than either alone in chronic lower back pain relief. Anti-inflammatory diet. Why it helps. Diet influences inflammation, tissue repair, and body weight, all of which impact spinal health. Foods to include: leafy greens, spinach, kale, berries, and citrus fruits. Fatty fish, salmon, mackerel, nuts, seeds, olive oil. Turmeric and ginger foods to avoid. Processed meats, refined sugar and flour, fried foods, excess dairy or gluten for sensitive individuals. Scientific backing. The British Journal of Nutrition reports that omega-3s and polyphenols reduce inflammation markers linked to chronic back pain. 6. Physical therapy and manual therapy. Why it helps. Trained professionals can identify specific imbalances, guide customized rehabilitation, and use hands-on techniques to relieve tension and promote mobility. Techniques include manual joint mobilization, soft tissue massage, trigger point release, guided therapeutic exercise. Scientific backing. A study in archives of physical medicine and rehabilitation showed that physical therapy reduced pain scores by up to 50% in seniors after 12 weeks. 7. Sleep optimization. Why it helps. Restorative sleep is essential for healing. Poor sleep worsens pain sensitivity and slows tissue repair. Tips. Sleep on your back or side with a pillow between knees. Use a firm mattress with lumbar support. Avoid screens and caffeine before bed. Scientific backing. Research in sleep. Health found that seniors with better sleep hygiene reported 35% lower back pain severity. 8. Stress reduction and mental health support. Why it helps. Chronic stress and poor mental health increase pain sensitivity, muscle tension, and inactivity. Practices mindfulness meditation, deep breathing, exercises, social connection, and therapy. Scientific backing. Mind-body interventions, including mindfulness-based stress reduction, MBSR, were shown in the Journal of Pain to significantly reduce chronic back pain intensity and improve function. 9. Weight management. Why it helps. Reducing excess weight decreases pressure on the spine and improves mobility. Tips. Combine light exercise with dietary changes. Seek medical guidance for weight loss plans. Scientific backing. A 2020 study in obesity reviews linked a 5 to 10% weight reduction with significantly lower back pain scores. 10. Medication and professional treatments, when necessary. Why it helps. In some cases, medications or advanced treatments are necessary to manage severe symptoms. Options: NSAIDs or acetaminophen with doctor's approval. Corticosteroid injections, radiofrequency ablation for nerve pain, surgery last resort. Scientific backing. Guidelines from the American Geriatrics Society recommend conservative treatment first, reserving invasive procedures only for non-responsive cases. Conclusion. Managing back pain in seniors is not about quick fixes, it's about building consistent health-promoting routines. From gentle exercises and posture awareness to anti-inflammatory diets and emotional resilience, every small step counts. These evidence-based strategies empower older adults to live more actively, independently, and pain-free. If you're a senior or a caregiver, start applying just 2 to 3 of these strategies this week and observe how your body responds. Even modest changes can lead to remarkable improvements in comfort, sleep, and mobility. Welcome to Part 3. We've already uncovered 10 daily habits that silently harm your back. Now let's finish strong with the final set of habits, the ones most people overlook. And then I'll give you the complete roadmap to protect your spine and live pain-free after 60. Habit 11. Poor sleep quality. We've talked about sleeping positions, but now let's look at sleep quality itself. When you don't get enough restorative sleep, your muscles never fully recover, inflammation rises, and your pain tolerance drops. Poor sleep creates a cycle where back pain disrupts rest, and lack of rest makes back pain worse. The Centers for Disease Control and Prevention, CDC, reports that older adults who sleep fewer than 6 hours per night are 40% more likely to experience chronic back pain than those who sleep 7 to 8 hours. Solution: stick to a consistent sleep schedule. Create a calming bedtime routine, dim the lights, avoid screens, and stretch gently before bed. If pain wakes you up, adjust your pillows or mattress for better support. Habit number 12. Poor posture with modern devices. Many seniors spend hours on smartphones, tablets, or watching television. But leaning forward, craning the neck, or slouching adds unnecessary stress to the spine. Over time, this tech posture can lead to chronic pain and even spinal changes. The American Academy of Physical Medicine and Rehabilitation warns that poor posture while using devices is a growing cause of back and neck pain among older adults. Solution: hold devices at eye level instead of bending your neck. Take breaks every 20 to 30 minutes to stretch and reset your posture. Sit with your shoulders relaxed and your back supported. Habit number 13. Skipping regular checkups. Ignoring routine medical visits is one of the biggest mistakes seniors make. Back pain can often be linked to underlying issues such as arthritis, osteoporosis, or spinal degeneration, conditions that need professional management. The American Geriatrics Society recommends yearly checkups for spine and joint health after age 60, even if pain seems mild. Early detection allows for simple interventions before problems become severe. Solution: schedule annual checkups with your primary care doctor. Ask about bone density scans and spinal evaluations. Don't wait until pain is unbearable. Prevention is far more effective. If you've made it this far, thank you for staying with me. Please hit the like button if you haven't already and share this video with someone who could benefit. And I'd love to hear from you in the comments. Which habit are you planning to change first? Recap and final thoughts. Let's recap what we've covered. Across 3 parts, we've identified 13 daily habits that you must stop immediately if you want to protect your back. Sitting too long, sleeping in poor positions, ignoring core strength, lifting the wrong way, ignoring warning signs, wearing the wrong shoes, eating inflammatory foods, living with constant stress. Overusing pain medication, skipping exercise, poor sleep quality, poor posture with devices, skipping regular checkups. Each habit may seem small on its own, but together they create the cycle of pain that so many seniors live with. The good news is that by stopping these habits and replacing them with the solutions we've discussed, you can dramatically improve your health, mobility, and quality of life. Remember this: turning 60 does not mean surrendering to back pain. With the right daily choices, you can strengthen your body, protect your spine, and enjoy the freedom of movement for many years to come. If you found this video helpful, please like it, share it with someone you care about, and subscribe to this channel for more science-based tips on senior wellness. Don't forget to hit the notification bell so you never miss an update. And now, I'd love to hear from you. Which of these habits surprised you the most, and which solution will you try first? Leave your answer in the comments below. I read every single one. Thank you for watching, and here's to a stronger, healthier, and pain-free life after 60.